When I was in the university, we went to this community to provide free medical services. We were able to treat all the conditions except eye problems. Yet 50% of the people who came to the camp had eye problems. I asked our professor why we were not able to treat and manage most of these conditions. He told me there were very few eye doctors in the country to be able to spread all over the country to treat them. When I became a doctor, I had a foreign object enter into my eye. I had to travel 60 kilometers to the nearest eye clinic for the object to be removed, a procedure which lasted only 10 minutes. I couldn't help but ask myself how the patients who didn't have means like me were feeling or were able to access the eye services. So after graduating as an ophthalmologist, I requested to be posted to Kitale County Hospital to be close to the community which I interacted with during my training. When I reached Kitale, I came face to face with the realities of delivery of eye care in Kenya. I had one room which was 4 meters by 4 meters. I was the only ophthalmologist in charge of 2 million people. To put into perspective, in UK, there would be 108 eye doctors in charge of the population that I was taking care of. I was covering an area of 89,000 square kilometers, which is the size of Portugal, and I only had a staff of 6. In the outreach place, the infrastructure was less developed. The patients came late with conditions that could be treated or prevented, and children often accompanied the elderly parents, guiding them through the paths to be able to access the eye services. I couldn't help but wonder, these children were missing on their education, as well as the parents were not engaging in their day-to-day economic activities for their families. At the end of the day, I would always go back to my hotel room and I would cry because there are patients which I wish they had come yesterday and I would have helped them, but they presented quite late. I decided to go to study further to learn the principles of preventing such eye conditions. During school, we learned that there are about 1.1 billion people with visual impairment and about 43 million who are blind, just like the ones I saw in my community. And 298 million have moderate or severe visual impairment. Most of the people with this visual impairment live in lower and middle income countries such as Kenya. And women, disabled people, and people who live in rural areas were mostly affected, which is a picture that I was used to back at home. They presented with conditions that can be treated or prevented. When I reflect back in Kenya, the situation is not any different. There are about 1 million people with visual impairment and about 300,000 who are blind. And the common causes of their blindness are cataracts, trachoma, corneal ulcers, and glaucoma, all which can be treated or prevented. And to my joy, Operation Eyesight Universal, which was assisting the nearby region, agreed to partner with us in the journey of elevation of avoidable blindness. It provides such a joy when you know that there's a partner who is willing to assist you and hold your hand through the challenges that one is facing. Together with Operation Eyesight in partnership with Ministry of Health and the Government of Kenya, we were able to build this magnificent eye unit and equipped it, and we were able to move from the kitchen size eye clinic to this modern eye clinic that you can see. We were also able to train eye care workers so that we can have complete eye teams to provide quality eye care. Together, we started building satellite centers to be able to support and decongest Kitale Eye Unit. And As you can see, over the period of from 2003 to 2019, the number of patients we are seeing at Kitale Hospital has been increasing. In 2005, we were seeing about 8,000. And by 2015, as you can see there, we are actually seeing about 25,000. Subsequently, you find that the numbers are dropping because of the completion of the satellite units, and some of the patients are now going to be attended in those areas. If you look at the graph of the surgeries as well being seen, you can see the same trend whereby there is on the rise. And similar trend was seen also in the satellite units. We are happy and impressed with the numbers that have been increasing over time. But behind every number is actually a real person who has been transformed, or whose life has been transformed and potentially prevented from going blind. When we provide eye care services to these people, we are contributing towards universal health coverage, health for all humanity. Universal health coverage is not universal without eye care. And for universal health coverage to be universal, the services must be affordable, they must be equitable, and they must be of high quality. And above all, the services must be anchored in a national policy so that they are available throughout the time, and they are linked and integrated to other services, and there's a plan for eye health workforce. And above all, there has to be a financial mechanism to sustain all the services over a period of time. We have developed new innovations together with Operation Eyesight to provide universal health coverage. This includes the hospital community approach, where communities are empowered to identify people with visual impairment and referred to eye health facilities to be treated. Community health workers are trained to identify those in need. And once all the people with visual impairment have been identified and referred, the villages are declared free from avoidable blindness. We have also adopted a new approach of task shifting with assistance of technology. Through the portable eye examination kit, non-eye care workers are now able to accurately measure and identify people with visual impairment. As we are aware, children don't know that they have visual impairment, and somebody has to go to them and identify those with visual impairment. Through this technology, we were able to screen 20,000 children in 9 days, and this was done by 20 teachers. This was quite a faster way of identifying children with visual impairment, and also being done by non-eye care workers. This approach gave us confidence that we can be scaled and we can reach many children as much as possible. We used this approach to screen all children in my region, and we were able to cover 200,000 children in 400 public primary schools, and those with visual impairment and eye problems were treated. We are very happy and glad and celebrate our achievements, but we know there are challenges. These challenges appear to be enormous, but I believe if we work together, we can overcome them. There's a Kiswahili saying which says, kidole kimoja akivunji chawa. If we work together, we are stronger if we work together. I believe we are strong by working together. We will be able to go far to each and every community, each and every household, and identify people with visual impairment and be able to treat and manage them, so that each and every person, be it Mohammed, Ali, Aisha, Peter, John, is able to realize their full potential, and this world will be a better place for all of us to live in. Thank you.